While rising COVID-19 case counts are currently the big news out of Northern Ontario, it's just the latest in a year that saw a lot of important stories from that part of the province. With us for a look back, Charnel Anderson, who covers the Northwest for Ontario Hubs. She joins us from Thunder Bay. And Nick Dunne, who covers the Northeast for the Hubs and joins us from Sudbury. Welcome to both of you.
Thank you.
Thanks.
So Nick, let's start with you. Can you give us the latest on the outbreaks in Northeastern Ontario?
Right. So the Northeast has really been the epicenter of the fourth wave as far as cases and case rates go. Most notably, Algoma has consistently led the top case rate in the province per 100,000 people. The health unit hasn't been too specific as far as necessarily where this came from. There's been a lot of community spread. And it persists in various outbreaks in all sorts of different settings, but no particular area has been identified. In Sudbury, throughout November, we saw quite a bit of spread in schools, about 15 outbreaks that were school or school-related, including bus lines. So it was really spreading there. But since then, in early December, we're seeing Manitoulin Island really pick up. Wemekong, the largest First Nation on the island, has seen a major elevation increases, rather. And as far as Temiskaming, it has also been very, very high as far as its case rate. But it peaked at around 80 cases on November 26. It's a very small health unit, so when there's a small increase in cases, it can really spike the overall case rate. That said, it's still a very small region, not a lot of hospital capacity. So it's been very much a concern for the health unit there as well.
I want to move west to Thunder Bay, where I understand the new variant, Omicron, has been detected there. Charnel, what do we need to know about that situation?
That's right. So earlier this week, the Thunder Bay District Health Unit issued a press release confirming that the Omicron variant has been found here in Thunder Bay. The health unit says that those cases are directly linked to travel. There's a direct link to South Africa, where, of course, the variant was first identified. And in that media release from the health unit, they suggest that these cases are contained to one household, saying that there is no evidence of spread outside the households. But even before the Omicron variant was discovered, we've been watching COVID cases rise in Thunder Bay. Over the last few weeks, there's been a number of outbreaks at both elementary and high schools. One school even closed for a week after almost 27 cases were connected to an outbreak there. So Dr. Janet Mill, the medical officer of the health of the Thunder Bay District Health Unit, is asking parents and guardians to screen their kids for COVID symptoms, reduce the number of contacts as much as possible, as well as keep their kids home if they're sick, in addition to, of course, getting vaccinated.
That's something I'm sure both of you will continue to follow as well. I want to touch on some other stories. I know we've been talking, you guys have both been on the show talking about the pandemic throughout the last, 2 years. But you guys have both talked about some other tough stories. I want to start with Nick. Are there stories that have stuck with you that you have sort of told throughout the several months?
Yeah, it's a tough one, Jayan. Obviously, the situation at Laurentian U with its creditor protection situation has been really, really a big one to watch up here. It's a really significant economic driver to the region. It's a place of higher learning for the entire region, not just in Sudbury. So that's been playing out in numerous ways. Most recently, the Auditor General is in court right now with Laurentian, trying to access certain documents. She said it's one of the least transparent institutions that she's ever worked with. But I think for me, the biggest story, and this goes nationally, has been the Kamloops discoveries of unmarked graves. This has really rippled across the entire country at a national level, but also at a hyper-local level. I mean, individual First Nations searching or contracting people out. It's really brought up a lot of difficult memories, and it's also been one of those stories that's been hiding in plain sight for the average Canadian, and a real wake-up call to what had happened and how this kind of plays out today in our current political landscape, social issues, and whatnot.
Charnel, I'll turn to you. Let's talk about your region. Is there any stories that stick with you throughout your reporting?
Yeah, so one story that really stuck with me is a piece that I did about hospital visitation policies during the pandemic. In order to slow the spread of the virus, hospitals began restricting visitation. And this decision had many consequences for, of course, patients, their families, and healthcare workers. And this decision also led to calls for more responsive, evidence-based visitation policies because in some cases, there were really tight restrictions in place when maybe there weren't enough COVID cases in the area to kind of justify those restrictions. And this meant that people couldn't be there for their families during some of the most precious times of their lives, right? Whether that's giving birth or comforting someone who's in the process of dying. And I think this stuck out with me because, unfortunately, my family, we lost my grandpa last month. And, he had been in and out of the hospital for a period of months. And there was one time last spring, my grandma went to visit him in the hospital in Thunder Bay, and she was told that she wouldn't be able to do that. And this was really frustrating, of course, because my grandpa was really agitated in the hospital in this unfamiliar environment. And I think, a familiar face might have been able to calm him down to really everyone's benefit. So there was a bit of a scene at the hospital. I heard that my grandma tried to kind of make a run for it past security to go see my grandpa. So she got sent home. But ultimately, they were able to sort something out and she was able to go visit him. But there was a lot of anguish in the meantime, right? And so, that was just kind of a story that is really about, these stolen moments that the pandemic has wrought.
And both very important stories from Nick and Charnel. I'm curious, looking into the next year, a lot of these stories will continue, but are there some stories that you guys are looking at and sort of have started to dig a little bit that we can look forward to? I'll start with Nick.
Right. So one big thing for me has been the Ring of Fire. I mean, it's really stuck in the environmental assessment process, both provincially and regionally from the federal Environmental Assessment Agency. So it'll be interesting to see how it plays out or doesn't play out, just given how long the delays have been across the board here and just the level of opposition. Another big one is the Robinson Huron annuity case, which I've written about. It's entering its third stage of negotiations where basically the Crown and the 26 First Nations in the Robinson Huron Treaty are going to be negotiating around compensation, around a future annuity. This has been an issue that's been lingering for about 150 years now, and I think lawyers, First Nations, legal experts are really looking to the precedent that this case could set as far as revenue sharing goes when it comes to resources and ongoing treaty discussions and disputes.
And Charnel, let's talk about sort of what you're looking at for the new year in terms of stories.
Yeah, well, so it's full on winter here in Thunder Bay. It's been really cold this week, which means, a lot of people are inside if they can be. And so, I'm just going to keep an eye on the COVID numbers and kind of see how that's going to be impacted this winter. But also, for the people that have nowhere to go this time of year, I want to look at the different supports that are available or not. We're waiting to hear the province's response to a proposal for a 40-bed mental health and addiction crisis center here in Thunder Bay. So I'll be following that for sure.
Some very important stories. And I want to say we really appreciate your reporting from the northern communities that you guys report from. And this is probably the last time that I'll be seeing you before the holidays. So happy holidays and wish you guys all the best.
Happy holidays.
You too. Take care.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.